difficult times for the Health Board, been difficult for a long time, and seemingly the difficulties don't go away. And I know that in our board development session earlier this week and in other meetings, the board want me to express their appreciation, their gratitude, and also their commitment, or their gratitude to all of our staff for the enormously significant and important work you're doing, and certainly to acknowledge you're doing that under very, very difficult circumstances, and also to support Carol and her team in all that we're trying to do to support people's well-being. So I wanted to share that from the board's perspective on behalf of me and my fellow board members. So thank you, Carol, and over to you.
Diolch, Carl, thank you very much indeed. Goodness me, what a long way we are coming with all of the technology. So thank you for testing that out for us. So that it worked from my perspective anyway, and I'm sure we'll get feedback. Afternoon, everyone. Prynawn da pawb. You're very welcome, as always, to the staff briefings. We started these, goodness me, what, 2.5 years or so ago, some time ago, and they all felt a little bit awkward at the start as we were getting used to Teams, but we wouldn't be without it now, and it provides a fantastic opportunity to come together. And I just want to acknowledge that the number of staff, we've got 98 staff as far as I can see, and a couple of other contributors. So what no better way of coming together at this stage using our technology. So couple of things this afternoon we wanted to share in particular, but just in the usual way. I always feel this is a great chance for question and answers, people to put their comments in the chat bar. If you want to share what you've been doing in your team, or developments that have been achieved, or things you have noticed in the Health Board, please do put that in the sidebar. We've got some very regular contributors. I'm sure they're going to be tuning in today. So don't forget to do that. I always find them really helpful. And if there are questions in there, we'll pick them up as always. And as you always are, respectful of each other's roles and positions in relation to messages that we post. So we're going to cover planning for the future. And Carl alluded to some of the discussions we had at the board earlier in the week. We're going to cover industrial action, because that certainly is all around us in our day-to-day lives, and here in the health service as well. And I'm delighted Deb's going to take us through some of the key elements there. And then well-being. You know, now more than ever is the time for us to pay attention to our own well-being and those of our friends, family and colleagues. And we take that responsibility to play our part as a health board really seriously. So I'm going to say a few things around that, and Deb will input as well there. So that's great. So let's kick off with planning for the future. So, you know, it's been quite a time, hasn't it, in terms of the last couple of years, you know, more or less the whole of 2020 and 2021 in the pandemic, as we've come through this year, moving out of the pandemic slowly. It is still with us, you know. COVID is here to stay, and us learning to live with COVID feels very key for us to adapt to. But it is still around. But a whole host of new challenges that have come our way, and I thought just to share some of those challenges, but also to think about the opportunities that we've got ahead as well. I'm going to start with the challenge of winter. It really does feel like winter now, doesn't it? The temperatures have dropped, and we know that with the whole backdrop of the cost of living, the cost of energy to heat our homes, the cost of fuel to transport ourselves around, that very many people are feeling a direct impact on their own ability to live as they were living before these costs came through. So the impact of winter on top of everything else is really causing some real service challenges. Many of you will be working in the front line of supporting people to access healthcare through the urgent and emergency care system, through our community hospitals, community services, and ideally back home. And that is a significantly pressured environment at the moment. The BBC today, and not the only media outlook, ITV Wales yesterday, really focusing on where the NHS is at the moment. And I said in a meeting on Tuesday that I've never experienced the pressures that we've got now in the whole of my 30 odd years in the NHS. So they are quite exceptional. And to reinforce the thanks and reiterate those that Carl has given to everyone who's working in tremendously challenging circumstances, and to recognise the resilience that services are showing, actually, and the resilience of staff. Now, that may not always be there, and hence, we wanted to spend a little bit of time on well-being today to try to build our resilience to cope with these challenges. But in amongst the here and now, there are challenges for the future as well. And if I just give a few sort of remarks around those, we are about to have the Welsh Government budget on the 13th of December. The Welsh Government will publish their budget. And whilst the autumn statements from the Chancellor at the UK government level said they were looking to protect the health service, we're starting to understand that the level of protection that is likely to come through will not cover all of those costs that are associated with an increase in inflation. What that really means is I think we are looking at the potential of a real terms cut in the funding that we have available to us. Now, we won't know that for sure until we get the correspondence from Welsh Government, and that's likely to be another week or two after the budget is announced. And I'm hoping it'll be better than we fear, but we're starting to plan on, a significant financial difficulty in terms of what's available to us as an organisation. Now, you can do your own calculations. Everyone knows that the inflation rate is around 10%, 11%. So things cost that much more than they did before. And so, we're spending money heating buildings. We have to buy food for patients, clearly. We buy other supplies, consumables, the costs of medicines have gone up. So very real effect coming through. And then, of course, for staff individually and collectively, the pressure on salaries is huge. And we will touch on the industrial action. I want to recognise that for individuals, the overall economic position is very tricky indeed. So we've got a big money issue coming down the chute at us. We know we've already got a big workforce issue. We see that day in, day out. And, thanks to Deb and her team over the last couple of weeks, been doing some really important work on looking at the projections for, what's likely to happen with the workforce picture in 3 years, 5 years, 10 years. So that helps us to understand what type of workforce we're likely to be able to have. I'm one of these. There's very many of us, a very high proportion in the health board who are in the over 50s group. So, we've got perhaps a lot of our expertise of colleagues across the health board likely to retire in the next 10 or 15 years, and we've really got to then understand how we plan and bring forward the subsequent generations. And then really importantly, the demand for the services provided by the health service are enormous, and our capacity to respond to that is restricted. I know you know this because you are experiencing it every day. That's right the way across the system. We hear about primary care. We certainly hear about social care and the real absolute challenge in social care. It's a very real issue here. The prospect of improvement at the moment, if we do nothing, is extremely challenging. And we've not been able to yet fully achieve all of the backlog appointments and procedures for the people of Powys. We've done brilliantly as a health board, but we know that there's a lot of people, our residents who access care outside of the county, who have been waiting a very long time. And all of that sits on a health inequalities picture where people from more challenged, more deprived socioeconomic circumstances are being hit the hardest by all of these issues, the cost of living and access to healthcare. So, sorry that that's a bit gloomy, but what I do want to say is, we're not going to be sitting on our hands as an organisation. I know that that's not the type of organisation we are. So we are now actively planning for the future. What needs to change? What options have we got to ensure that our services are sustainable and can be sustained over the next 5 and 10 years? We know that our population is getting older. It's not growing particularly, but the age profile is changing. And we know that the demand for healthcare changes with that changing profile as well. And then the proportion of people who are in the younger working age group gets smaller. So if you're working in the health board, we're very, very keen to engage you and involve you in some of the ideas and the thinking for the future, because I think where we're getting to is if everything stays the same and we do nothing to plan for the future, then we will have these unplanned service issues and potentially services having to urgently close. And we've had 2 of those, if I mentioned the ward at Knighton and the ward at Creek, that happened during the pandemic. So we want to be able to avoid that if we can. So we met on Monday as a board and had a great session, really exploring some of the challenges. We're trying not to quite get into too much of the design work and the opportunities, but come the new year, very keen to engage with colleagues right the way across the health board in those ideas coming through. And many of you have already submitted a range of innovation ideas to the Research and Innovation Hub, and I know that colleagues there are working through. So we'll be building on that and taking that forward. This might mean that we're into a period of having to really consider what we do and where we do it. And my commitment is to engage with people in that open way, moving forward. And often when we're challenged, as we were in the pandemic, this health board can deliver fantastic things. So I'm optimistic that we can create really good services for the people of Powys. So more from me on that in subsequent Chief Exec staff briefings, and I look forward to sharing that. Any thoughts and comments on any of what I've said in the meantime, though, please do get in touch with me or with the engagement team, Adrian, Tin and colleagues, and we'll be keen to hear from you. That's probably it from me for this bit. I will come back a bit later and I will be looking at the chat bar, and we'll be picking up some questions and answers a bit later on. But I'm going to hand across to Deb now on industrial action. It's here and now, and I'm sure there's a lot of interest in what's going on, what's likely to happen, etc., etc. So thanks very much, Deb, for contributing this afternoon. Over to you.
Diolch, Carol. Prynawn da, everybody. just thought it was timely to bring all colleagues up to date with the significant planning that has already taken place in readiness for industrial action by the Royal College of Nursing on the 15th and 20th of December. And I think in setting that out, just really acknowledging that this is an unsettling time for people. And I think we just wanted to make that kind of front and centre, that we understand that there are many questions that individuals might have around this. The Health Board has a neutral position with strike and fully respects the right of staff involved in a trade dispute to strike. The Royal College of Nursing is currently the only trade union taking strike action against the Health Board. However, we do know that there are other activities happening in other organisations, as you can see on the slide. Perhaps noteworthy is the WASP strike with the GMB on the 21st and 28th of December. So just to flag that up. We are awaiting the results of other ballots, and we will update people once they are known. The safety of staff is clearly, the safety of patients and staff is clearly paramount, and that's been a real kind of core focus around our planning. And as I said, considerable discussion and detail has already been worked up when considering the impact of Royal College of Nursing members, some of whom will obviously take part in that strike action. Nationally, the Royal College of Nursing have agreed certain exemptions. Exemptions have sometimes been referred to as derogations, so you might see that word being used. And they've agreed the national derogations on a life-preserving care model. What that means for the Health Board is that we've taken the national derogations, we've interpreted those for our local setting, and we are in discussion with a local strike committee on what that means and where we need minimum staffing levels according to a Christmas Day service across areas such as inpatient wards, minor injury units and community services like district nurses. As part of the planning, we will be following a control and command structure, and for those that were taking part in any of those, you'll be familiar with terms like bronze, silver and gold, and we will be putting that in place leading up to the strike, the day of strike and the days that follow in between the two known dates for strike action for us. To support everybody's understanding and help with any questions that you might have, we've already issued on the intranet frequently asked questions, and we will be updating those as and when more information becomes available. So if you haven't yet accessed that, I would ask you to go and take a look, and hopefully it provides a useful source of information. I would just draw out one of the questions and answers, which is around the exemptions and the ability for an individual to ask for a personal exemption. And that might be as a result of a long-term impact for them financially. Now, we realise some of that is quite personal, and what I would ask you to do is, if not comfortable talking to your line manager in the first instance, then you can come through to me personally, or you could speak to Mark McIntyre or Lorna Simpson in the Workforce and Organisation Development team, and we can help support any individual applications to the local strike committee should they be necessary. Clearly, as I said, we will be updating as and when we've concluded some of the discussions with our local strike committee, and we will be updating the intranet and the internet, because clearly it's important for us to get messages out to the public as well. I'll pause there. I'm not sure if there are any specific questions on industrial action, but happy to take them either now in this setting or following this meeting. Thanks, Carol.
Oh, thanks very much, Deb. There's a lot of work, and even though we are in a strike scenario, I would say we have very good relations with the Royal College of Nursing and with other unions. So there's a recognition that there isn't a dispute as such between the union and the health board. And that is, it feels important for me to say that, because this isn't easy, is it? When we get a ballot and we have to decide, do we want to strike or not? And most people will not want to strike, but feel that they have no option. And look, we're understanding of that and trying to deal as best we can with a difficult challenge all around. So thank you, Deb, for particularly flagging those individual sort of derogations as such in the process for people there, because these are very challenging times. So great. Well, in terms of we'll keep people up to date, and as I said, there's plenty of information on the intranet site. So and Deb is around for colleagues to follow up with. So thank you for that. I'll just check there isn't any questions specifically on the strike in the chat. No, I don't think so, but there's links, lots of links. That's brilliant. If we can move on then to the well-being, and very keen to first and foremost say hooray for the flu and COVID vaccination campaign this autumn, and again a fantastic job. And I've had the pleasure of saying what a fantastic job our vaccination services have been able to provide on many occasions. Now, it doesn't happen by chance. It happens because of great planning, great leadership, great teamwork, and of course people pitching up for their vaccine. And I think I said before, I had two in one arm at the same time, and it was wonderful to think I was trying to protect myself and others from these viruses. And importantly, yes, I can see that Reese has put something in the sidebar here. Thank you, Reese. Their second anniversary. I remember this so well. When people, momentous days, where were you when? I know exactly where I was when we started that vaccine campaign. It was just such a brilliant day, and how pleased people were, members of the public, some of whom it was their first time out, was to come to the vaccination centre and get their COVID vaccine. So absolutely phenomenal, brilliant. And here we are, 50,000 vaccines, and that's delivered just in the 2022 autumn booster programme. Now, I recognise life's really busy. There'll be people on this call perhaps who are thinking, oh God, I haven't done, I meant to do that, I meant to get along. There is still chance, so please do make that a priority before you get into the whole Christmas spirit. Get along to one of the vaccination centres, and staff are there waiting for you, and be able to provide your vaccination as well. So and that'll make Reese even happier. He's already proud, but we want to keep pushing on. If you can't get to a vaccine clinic, and we know that people are working from lots of different places, then get in touch with occupational health, and we may be able to get you set up for a flu vac appointment with a peer vaccinator. So there are some different modes of doing of getting it. We often put others before we put ourselves, don't we, in the NHS? And I just want to stress how important it is that you do get your vaccine. And we've always been a little bit competitive as a health board, haven't we, in terms of trying to get the best flu vac uptake rates and things like that. So let's get that competitive spirit going as well. And so, well, we'll keep you in touch with how it's going. There are lots of viruses around at the moment, and our health protection teams, I just want to have a shout out for them, if I may. They've been very busy during this year, during the last couple of years, and whether it's for monkeypox or now, I take the opportunity to raise awareness about the Strep A situation, in children and young people. There's advice available on the public health website, and we're putting that advice into those areas which will deal mainly with children and families, so that we are aware of that. So there is unfortunately a higher level of illness circulating, probably as a result in part of us being tucked away for so long. I'm going to move on then to the Wellbeing Roadshows, if I may. I was delighted yesterday to be one of those 50 colleagues who attended the relaunched Health and Wellbeing Roadshow. It was in the Health and Care Academy, that's what I was about to say. And this is the first, we'll be in Llanidloes next, 19th of December. So please do feel free to get along there and have a chat with people. I thought it was really, really useful. I picked up a couple of bits and pieces. I want to promote VivUp if I can. There's a little card that I picked up yesterday, and that's our employee assistance program. I downloaded the app a couple of weeks ago when I heard about it. Really easy to use. There's areas for discounts, so NHS staff getting discounts. It's definitely worth looking at that whilst you're doing your Christmas shopping. And then the other thing on money is the Money Helper material as well. You will be able to see these on our SharePoint intranet site, but worth getting across to there as well. Our library service was there, and I even had a hand massage, which was wonderful. So I'd go with that one. If you're in Ystrad, anywhere near Ystrad or Brecon in January and in February, the guys will be hanging out there. So please do look out for those dates. And if we can move into the next slide. So Yammer, you may not have come across Yammer yet. These are all the fantastic things that come with Microsoft 365. And Yammer, I was told, is a bit like a Facebook, but 365. And it's been really interesting because I've signed up and got in and all of that. I get little messages from lots of different people, so it's fabulous. And earlier on we were saying it's a great place to do a sort of buy and sell or exchange. Does anyone want a blah blah blah, going free to a good home, those sorts of things, a bit like a Saturday swap shop if you're of my generation. This marketplace looks to be something that could be very useful, in particular the recycle, reuse and pre-loved type of space. Colleagues, there we are. James, thank you, has put a link through there, so please do have a little look at it. Sign up. We're hoping it will be a really useful way of connecting with colleagues across the health board, and other health boards started to use it as well. So I've seen some of their place. It is a workspace, so just to be aware, it's not a public Facebook group, and some of the groups are set as private, and there's ground rules, all of those sorts of things that we should be acting responsibly on. And then I'm just going to move on to the next slide, which is really about the Certificate of Appreciation. Now, we had a fab event just a few working days ago, at the end of last week, I think. Yep, there we are, 2nd of December. And you may recall that we put these on as a way of trying to recognise the efforts of colleagues, particularly through the pandemic. And I've been blown away by how many citations are submitted about colleagues. I thought it might have sort of tailed off, but no, it's as strong as ever before, and even stronger in the area of learning and development. So we're really seeing the efforts and the achievements of colleagues who've taken on learning, getting qualifications, who are developing themselves, and I think that gives us all motivation. We're all still learning, aren't we? So I want to congratulate those colleagues who were part of the Certificate of Appreciation last week, but also to thank the colleagues who take the time. Time's such a precious commodity, but they take the time to write down and share what it is that they appreciate about their colleagues around them. I know that that has a huge and a hugely positive impact on people. And so a huge thanks to you for taking the time. If you've ever put a citation forward, if you haven't yet, there's always time. So we are keeping these open. The entries for the next round close on the 24th of February, and that will take us into the March event. So why not have a little look and make your appreciation of your colleagues known to us. And then I just want to sort of draw Deb in, because one of the key things for us as an organisation is to ensure that we're doing all we can with colleagues across the organisation to support. So I know Deb, as being relatively new to the organisation, is very keen to hear of ways in which we can support. So Deb, I don't know if you wanted to say a couple of things, and then I'll come back to the seasonal greetings backdrops.
Of course, yeah, I did put it in the sidebar, but just in case people haven't read that far down yet. As Carol said, we're kind of all learning, and I guess in that respect, if you think that there is more that we can do that we're not already doing, if there is a need that you think we're kind of not meeting, then I would urge you to get in touch with us. We've already put a range of resources on the intranet. You'll see wellbeing resources. Carol's just referred to VivUp, and I could see that Sarah put in the chat bar some kind of winter resilience sessions that we're about to put on over the next week or two. So I'd ask you to kind of have a look at those, check and share them, make sure that people around you are aware of what's already available. And if there's more that we can do, then of course we're more than happy to meet that need. I'd just like to kind of thank everybody that did attend the session yesterday. Unfortunately, I wasn't able to make it, but I hear that it was a great success, and it's great that we've brought the roadshows back into action. Thanks, Carol.
Yeah, fab. Thanks ever so much, Deb. And yes, I was hearing about the winter resilience workshops. They sound great, and an old colleague of mine helping us there. So that will be very engaging. So a little plug from me for that. And to thank the Workforce NOD team. Workforce is our biggest asset. So looking after people is really important, and the team are doing a sterling job in helping us to do that. So thank you very much. We have a new range of seasonal backdrops. There we are. I must say, huge thanks and congratulations to the comms and engagement team yet again for pulling out all the stops on here. I get so many comments in national meetings about the Powys backdrop. So these are going to be paraded around very actively over the next couple of weeks. I think, Carl, I might have a meeting with the minister on Monday. I'm wondering if I'll wear the one with the Santa hat or not. But there we are. I'll give that a bit of thought. But you could choose from a wide range. We talk about Christmas quite a lot, but other religious and non-religious celebrations and recognition of the holiday period. So please do. So we're loving the Santa hats. And just on the backdrops, I was looking at mine a bit earlier, and I saw the one about the Queen and about all of the little sort of collage, and lovely. And goodness me, hasn't 2022 been a year of challenge and a year of change? And I will be saying more in Christmas messages just over the next week or so, but I would like to draw this to a close by thanking you all for everything that you have done. I think the challenging circumstance of the country can be coped with, I think, when we have great teamwork, a great commitment and a common purpose. And I'm astounded every time I go out that there's plenty of that in bucket loads. I was in Newtown last week. I went to the hospital, met the district nursing team, the therapy team, the ward team, went to Underster Plant, met therapists, school nursing colleagues, safeguarding colleagues, and everyone remains so committed to doing the very best for the people of Powys. So diolch yn fawr iawn, thank you all very much indeed. And as this is our last staff briefing before Christmas, I'd like you to have a wonderful Christmas. Please have a rest if you can. It is challenging, but there is, there will be better times as a country for sure. And we can look forward, I hope, to a very successful 2023 ahead. So with that, diolch yn fawr iawn. Thank you all very much indeed, and have a lovely few weeks of the seasonal period. Thank you. Bye-bye now.
Thanks all.